This family health and wellness segment is brought to you by GlaxoSmithKline Consumer Healthcare.
As a mother, you want the best for your family. For healthy gums, strong teeth and fresh breath, switch to Aquafresh All-in-One Protection. Aquafresh does it all in one, mum.
Looking after your child's oral health is an important responsibility for every parent. And with me today is dentist Dr. JJ Serfontein, and he's going to give us the do's and don'ts. Doctor, when should you start looking after your child's oral health?
Well, the responsibility really starts when the very first tooth erupts. And the responsibility is with the parents to make sure that we clean these teeth on a regular basis so that we don't run into trouble. From there on out, the most important things that we need to look out for are, first of all, baby bottle caries. In other words, when children sleep and they go to bed with certain substances inside bottles or on dummies, they will damage the teeth. And then we're looking at habits like dummies, like thumb sucking, and then of course the eruption patterns itself, that we need to make sure that this happens on a regular basis.
Why are milk teeth important, and why should you look after them?
Well, milk teeth are actually very important, and the importance lies in the development of the oral cavity and the development of the whole myosystem really for later on. And we often see that this is neglected as parents because we're going to have a second set of teeth. The importance lies in this, that first of all they are very, very important space maintainers, meaning that if we have an early loss of these teeth and the permanent teeth do erupt, they will erupt in an irregular position, and this can create massive orthodontic problems later on. And then of course if we lose teeth in front too early, we will create phonetic problems, we can have speech impediments because of it. And then I think the most important part is if we have early loss of teeth, especially in the front, children will not move from an infantile swallowing pattern to an adult swallowing pattern, thereby creating what we call a tongue thrust. And this will eventually lead to breathing mouth syndrome, something that a lot of people don't know about, and will lead to immense problems later on in adulthood.
So how do you actually brush those little teeth?
Starting very early on, it is okay to actually just use something like a cloth when we've got maybe one or two teeth, and later on we need to move into proper toothbrushes, etc. But I think the important rule here is that there is no golden rule, and it's the parents' responsibility. It's not good enough to say that because I can't get into the child's mouth that they run into tooth decay later on.
When can you allow your child to brush their own teeth?
Well, the thing is this can happen at any age, and it's actually a good idea to start introducing this at an early age. That creates the responsibility that we need later on in adulthood, especially in our second set of teeth. But once again, there's no golden rule here. The important things to note is that once again the parents are responsible. Here is also for the parents to see that the toothpastes are not swallowed, especially when they're a little bit younger. But I mean, you make it fun and definitely introduce this as early as possible to create a responsibility, without a doubt.
Why should we use toothpaste that's especially designed for kids?
There's a couple of reasons why we should have a different toothpaste for kids. Of course, they should be less abrasive. There's a couple of things in the toothpaste that will, of course, treat the pH and make sure that we don't run into too acidy scenario in the oral cavity. But the most important issue here is the issue of fluoride. A lot has been said about fluoride over the last 4 or 5 years. It's a very controversial topic. And due to the fact that fluoride toxicity is now being proven to actually have an effect on the system and can create bone cancers, and they can create problems for the digestive system and for the liver and the kidney. So the question here is, do we give too much fluoride or do we give too little? Fluoride can aid, when it's applied topically, can aid in the strength of the enamel. But when we level up to a certain level in the system can't handle it, and we go into fluoride toxicity. Fluoride toxicity can start with syndromes like fluorosis. It can have an adverse effect on everything in the system, a lot of the organs, and we need to ask ourselves that question. So I think it's very important to discuss this with your dentist, to look at your specific area in the country what the fluoride content of the water is, how much oral supplement should you give in fluoride, and then of course to make sure that these toothpastes for children should have either no fluoride in it to control it, or it should have very little. And I think this is important because only 1 gram of adult toothpaste can create toxicity in the system, and this is really just a little bit of adult toothpaste on a toothbrush.
Well, Doctor, thank you so much for your excellent advice. If any of our viewers have any further queries or concerns on this topic, we suggest you consult your dental practitioner.
As a mother, you want the best for your family. For healthy gums, strong teeth and fresh breath, switch to Aquafresh All-in-One Protection. Aquafresh does it all in one, mum.